Introduction to body waxing. Body waxing is a popular hair removal method that effectively removes hair from the root, offering longer-lasting smoothness compared to shaving. It is widely chosen for its effectiveness, affordability, and versatility, being suitable for both at-home use and professional salon treatments. The global hair removal market, including waxing, is projected to reach over $25 billion by 2028, highlighting its enduring popularity. This method provides a clean finish and can significantly reduce hair regrowth over time. Many individuals find that regular waxing leads to finer and sparser hair. The process involves applying a specialized wax to the skin, allowing it to adhere to the hair, and then quickly removing it to pull the hair directly from the follicle. Historical roots of waxing. Body waxing is a hair removal method with a rich history, dating back many centuries. The earliest evidence of body waxing can be traced to ancient Egypt, where women used beeswax to remove unwanted hair. In ancient Egypt, hair removal was not just about aesthetics, but also hygiene, especially in a hot climate. Cleopatra, for instance, was known for her elaborate beauty rituals, which included hair removal to signify youth and cleanliness. This practice was also popular in ancient Greece and Rome, where both men and women engaged in hair removal. They often used natural ingredients like sugar, honey, and resins, precursors to modern waxing techniques. Waxing through the ages. During the Middle Ages, body waxing experienced a decline in popularity. The prevailing Christian views of the time often regarded body hair as a natural sign of beauty, leading to a shift away from hair removal practices. However, body waxing saw a resurgence in the Renaissance period, once again becoming a favored method for hair removal. This renewed interest aligned with changing beauty standards that emphasized smooth, hairless skin. Since the Renaissance, body waxing has consistently remained a popular hair removal method. Today, it is a staple in beauty routines worldwide, with innovations in wax formulas and application techniques continually improving the experience. Hard wax, characteristics and use. Hard wax is a depilatory wax that is applied to the skin in a thin layer and allowed to cool and harden. Unlike soft wax, it adheres primarily to the hair itself, not the skin, making it ideal for sensitive areas. Once the wax is completely hardened, it is removed quickly by pulling the wax strip directly off the skin. This method does not require cloth strips, as the hardened wax forms its own strip. A significant advantage of hard wax is that it is generally less painful than soft wax and is also less likely to cause irritation or lift the skin. This is because it shrinks around the hair as it dries, encapsulating it for removal. Soft wax. Characteristics and use. Soft wax is a depilatory wax that is applied to the skin in a thin layer using a spatula. Unlike hard wax, it requires a cloth or paper strip for removal. After applying the wax, a cloth strip is immediately pressed firmly over the waxed area. The strip is then quickly pulled off, taking the wax and hair with it. While soft wax can be more painful than hard wax due to its adhesion to both hair and skin, it is highly effective at removing short, fine hairs. It's often preferred for larger body areas like legs and arms. Key benefits of body waxing. Body waxing offers several significant benefits, making it a popular choice for hair removal. One of the primary advantages is its long-lasting results, with hair typically taking 2 to 4 weeks to grow back, much longer than shaving. Waxing is highly effective at removing hair from virtually all parts of the body, including delicate areas like the bikini line and underarms. This versatility makes it a comprehensive solution for many individuals. Furthermore, waxing is a relatively affordable hair removal method. especially when considering the extended periods of smoothness it provides. Regular waxing can also help reduce the appearance of ingrown hairs by removing the hair from the root, promoting finer regrowth. Potential drawbacks of waxing. Despite its many benefits, body waxing does come with certain drawbacks that individuals should be aware of. The most common concern is pain, especially for those with sensitive skin or when waxing highly sensitive areas. Another potential issue is skin irritation, which can manifest as redness, bumps, or even minor swelling. This irritation is often exacerbated if the skin is not properly prepared before the waxing procedure. It is crucial to avoid waxing if you have specific skin conditions such as eczema or psoriasis, as the process can worsen these conditions and lead to further complications. Always consult a dermatologist if you have concerns about your skin's suitability for waxing. Pre-waxing skin preparation. Proper skin preparation is essential for a successful and comfortable waxing experience. It helps the wax adhere better to the hair and minimizes potential irritation. Always start by ensuring the skin is clean and dry. One crucial step is to exfoliate the skin 24 hours before waxing. This process helps remove dead skin cells, allowing the wax to grip the hair more effectively, and reducing the risk of ingrown hairs. Using a gentle scrub or exfoliating mitt is recommended. Additionally, avoid using lotions, oils, or heavy moisturizers on the skin immediately before waxing, as these can create a barrier that prevents the wax from properly adhering to the hair. For longer hairs, trimming them to about 1/4 inch, 0.6 centimeters, is vital, as excessively long hair can make waxing more painful and less effective. Health and safety overview. Body waxing, while generally safe, involves potential health and safety risks that require careful consideration. Understanding these risks is crucial for both practitioners and clients to ensure a safe and effective treatment. This section will delve into various factors that can make waxing unsafe, including specific skin conditions, certain medications, and other underlying health concerns. It is vital to assess these elements before proceeding with any waxing service. Adhering to strict sanitation and infection control procedures is paramount in any waxing environment. Proper hygiene practices prevent the spread of bacteria and ensure a clean, safe experience for everyone involved. Skin conditions to avoid waxing. Certain skin conditions can make waxing unsafe and should be carefully evaluated before any procedure. Sunburned skin, for instance, is highly sensitive and inflamed, and the heat from the wax can further irritate and worsen the burn. Conditions such as eczema, psoriasis, and other skin rashes also increase skin sensitivity to both the heat and chemicals in the wax. Waxing over these areas can trigger flare-ups, cause severe irritation, and significantly increase the risk of infection. It is always recommended to wait until any active skin condition has completely healed before considering waxing. If in doubt, a patch test on a small, inconspicuous area can help determine skin reaction. Compromised skin and growths. Waxing should never be performed on skin that is compromised in any way, as this can lead to further damage and infection. Cuts, scrapes, and open sores are particularly vulnerable, as waxing can irritate the broken skin and introduce bacteria. The process of pulling wax can also tear or exacerbate existing wounds, leading to prolonged healing times and increased discomfort. It is essential to allow these areas to fully heal before considering waxing. Furthermore, waxing over warts, moles, and other skin growths is highly discouraged. The pulling action of the wax can damage these growths, potentially causing bleeding, infection, or even altering their appearance, which could complicate future dermatological assessments. Medications and waxing interactions. Certain medications can significantly interact with waxing, making the procedure unsafe or increasing the risk of adverse reactions. It is crucial to inform your waxer about all medications you are currently taking. Blood thinners, such as warfarin or aspirin, can increase the risk of bleeding and bruising during and after waxing. The mechanical action of hair removal can cause capillaries to break more easily, leading to more extensive bruising. Retinoids, including topical treatments like tretinoin and oral medications like Accutane, make the skin extremely sensitive and thin. Waxing while on retinoids can cause severe skin lifting, tearing, and burns as the skin's integrity is compromised. Similarly, alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs, commonly found in exfoliating skincare products, also increase skin sensitivity to heat and chemicals, making waxing risky. Other health considerations. Beyond skin conditions and medications, several other health concerns warrant caution or consultation with a doctor before waxing. Individuals with diabetes, for example, have a higher risk of developing infections due to impaired wound healing and circulation. Therefore, waxing may not be safe for them, especially if they have poor circulation in the area to be waxed. Phlebitis, a condition characterized by inflamed veins, can be worsened by waxing. The pressure and pulling action of waxing can further irritate the inflamed veins and potentially increase the risk of blood clots. It is crucial to avoid waxing directly over affected areas. For pregnant women, waxing is generally considered safe, but it is always advisable to consult a doctor before getting a wax. Hormonal changes during pregnancy can increase skin sensitivity, making waxing more painful or prone to irritation. Some women also experience increased blood flow, which can lead to more bruising. Salon sanitation and hygiene. Choosing a reputable salon or spa with stringent sanitation and infection control procedures is paramount for a safe body waxing experience. A clean environment minimizes the risk of bacterial infections and cross-contamination. When visiting a salon, observe key indicators of good hygiene. The waxer should always wear disposable gloves and a mask during the procedure to protect both themselves and the client from potential pathogens. This practice is a non-negotiable standard. Furthermore, a reputable salon will exclusively use disposable tools and supplies, such as spatulas and cloth strips, for each client. All surfaces and equipment, including waxing beds and trolleys, should be thoroughly cleaned and disinfected between clients to maintain a sterile environment. Studies show that unsanitary practices in salons can lead to skin infections in up to 15% of clients. Wax heater types and function. A wax heater is an indispensable piece of equipment in body waxing, designed to melt wax to the precise, correct temperature for safe and effective application. Maintaining the ideal temperature is crucial to prevent burns and ensure proper wax consistency. There are two main types of wax heaters commonly used in salons and for home use: single pot and multi-pot heaters. Single pot wax heaters are the most common, featuring a single reservoir capable of melting both hard and soft wax. Multi-pot wax heaters, on the other hand, offer greater versatility with multiple pots. This allows for different types of wax to be melted simultaneously, or for various waxes to be kept at different optimal temperatures, catering to diverse client needs or waxing techniques. The ideal temperature for most waxes is between 105 to 115 degrees Fahrenheit, 40 to 46 degrees Celsius. Hard wax forms, bead and disc. Hard wax comes in various forms, primarily beadwax and disc wax, each suited for different applications. Beadwax, often seen as small, colorful pellets, is melted in a wax heater and then applied to the skin using a spatula. This form of hard wax is popular for its ease of use and ability to be portioned precisely. It typically contains ingredients like rosin, beeswax, and various oils to ensure flexibility and strong grip on hair. Disc wax is another type of hard wax that comes pre-melted in a disc shape, ready for use after being warmed. It is particularly convenient for smaller, more delicate areas of the body, such as the underarms, eyebrows, and upper lip, allowing for precise application. Soft wax forms. Strip and roll-on soft wax also comes in different forms, primarily strip wax and roll-on wax, each designed for specific application methods and body areas. Strip wax is the most common type, applied to the skin with a spatula and then removed with a cloth strip. This traditional method is highly effective for larger areas like the legs and arms, where quick and efficient hair removal is desired. Strip wax typically contains ingredients like resins, paraffin, and often soothing agents like chamomile or aloe vera. Roll-on wax is a convenient and hygienic alternative applied to the skin using a roll-on applicator. This method ensures a thin, even layer of wax, making it ideal for larger areas of the body, such as the legs, arms, and back, and reducing mess. Essential waxing tools. Beyond the wax itself, a range of essential tools is required for a complete and hygienic waxing procedure. Spatulas are crucial for applying wax to the skin, coming in various sizes and shapes to suit different body areas and wax types. Cloth strips, typically made of non-woven fabric, are used exclusively with soft wax to remove it from the skin. They come in different sizes and colors, allowing for efficient hair removal on various body parts. Tweezers are indispensable for removing any stray hairs that the wax might have missed, ensuring a perfectly smooth finish. Gauze is used to protect the skin from hot wax, and can also be applied with pressure to minor bleeding cuts after waxing for quick hemostasis. Pre- and post-waxing products. A range of specialized products is used before and after waxing to enhance the experience, protect the skin, and ensure optimal results. Pre-wax oil is applied to the skin before waxing to create a protective barrier, reducing irritation and helping the wax adhere better to the hair, not the skin. After the waxing process, post-wax oil is essential for removing any remaining wax residues from the skin. It also serves to soothe and moisturize the skin, minimizing redness and discomfort. Many post-wax oils contain calming ingredients like lavender or tea tree oil. Powder, often talc-free, is applied to the skin before waxing to absorb excess moisture and oil. This ensures the wax adheres effectively to the hair, preventing it from sticking to the skin and making the removal process smoother and less painful. Detailed hard waxing technique. Hard waxing is a more advanced technique often preferred for sensitive areas like the bikini line and underarms, as well as larger areas like the legs and back. The process begins with thorough skin preparation. First, clean and dry the skin to be waxed, then apply a pre-wax oil to create a barrier and aid wax adhesion. Next, use a spatula to apply a thin, even layer of hard wax in the direction of hair growth, ensuring the wax is at the correct temperature to avoid burns. Overheated wax can cause burns, while underheated wax won't adhere properly. Allow the wax to cool and harden completely, which typically takes a few minutes. Once hardened, hold the skin taut and quickly pull the wax off in the opposite direction of hair growth. You may need to use both hands for larger sections, ensuring a swift, decisive pull to minimize pain and irritation. Detailed soft waxing technique. Soft waxing is a more basic technique, often used for smaller areas like eyebrows and the upper lip, and is a good choice for beginners. The process also starts with meticulous skin preparation. Begin by cleaning and drying the skin, then apply a pre-wax oil to protect the skin and help the wax adhere. Using a spatula, apply a thin layer of soft wax in the direction of hair growth, ensuring the wax is heated to the correct temperature. Overheated wax can cause burns, while underheated wax will not adhere properly. Immediately place a cloth strip over the wax and press it down firmly. Rub the strip in the opposite direction of hair growth to ensure maximum adhesion. Then, hold the skin taut and quickly remove the strip in the direction of hair growth, ensuring a swift, decisive pull to minimize pain and irritation. Waxing specific body areas, legs and arms. Body waxing can be performed on various areas, each with its unique considerations. The legs are one of the most popular areas for waxing, known for their relatively thick and sturdy skin, which can tolerate the heat of the wax well. When waxing legs, it's often helpful to start at the calves and work your way up to the thighs and buttocks, preventing the wax from pooling too quickly. For legs, trim hair to about 1/4 inch. Apply pre-wax oil, heat wax to the recommended temperature, and apply a thin layer in the direction of hair growth. Allow to cool, hold skin taut, and remove quickly in the opposite direction. Be especially careful when waxing the knees, as the skin in this area is more delicate and prone to irritation. The arms are another popular area for body waxing, though the skin here is thinner than on the legs, requiring a lower temperature wax. Start by waxing the upper arms and work your way down to the forearms and hands. Be particularly careful when waxing the underarms, as this area is highly sensitive and prone to irritation. Using a smaller spatula for curved areas like elbows can improve precision. Waxing specific body areas, bikini and other. The bikini area is one of the most sensitive areas for body waxing due to its thin and delicate skin. It is crucial to use a low-temperature wax and apply it very gently to minimize discomfort and irritation. Starting at the top and working downwards can help minimize discomfort. For the bikini area, trim hair to about 1/4 inch. Apply pre-wax oil and heat wax to a lower temperature than for legs or arms. Use a small spatula to apply a thin layer in the direction of hair growth. Allow to cool, hold skin taut, and remove quickly in the opposite direction. Always apply post-wax oil to soothe the area. Body waxing can also be performed on other areas like the back, chest, stomach, and face. These areas are generally more sensitive than the legs and arms, so a low-temperature wax and gentle technique are essential. Always perform a patch test on a small, inconspicuous area before waxing a new sensitive body part. Immediate post-wax care. Proper post-wax care is crucial for minimizing irritation, preventing infection, and ensuring your skin looks and feels its best after a waxing session. The immediate steps taken after waxing significantly impact recovery. Immediately after waxing, apply a specialized post-wax oil or lotion to the treated area. This product helps to soothe and moisturize the skin, reducing redness and discomfort, and effectively removes any lingering wax residue. Many contain anti-inflammatory ingredients like aloe vera or chamomile. It is also vital to wear loose-fitting clothing after waxing to prevent friction and allow the skin to breathe. Tight clothing can irritate the freshly waxed skin and trap sweat, which can lead to breakouts or ingrown hairs. Additionally, avoid hot water, swimming in pools, hot tubs, or the ocean for 24 to 48 hours, as these activities can irritate the skin and introduce bacteria. Ongoing post-wax care and prevention. Beyond immediate care, ongoing post-wax care is essential for maintaining smooth skin and preventing common issues like ingrown hairs. Continue to apply a post-wax oil or lotion to the skin daily to keep it hydrated and supple. Gentle exfoliation of the skin every 2 to 3 days, starting a few days after waxing, is highly recommended. This helps remove dead skin cells that can clog pores and trap new hair growth, significantly preventing ingrown hairs. However, avoid harsh scrubs or chemical exfoliants immediately after waxing. Always apply a sunscreen with an SPF of 30 or higher to any waxed areas exposed to the sun. Freshly waxed skin is more susceptible to sun damage and hyperpigmentation. Additionally, staying hydrated by drinking plenty of water and maintaining a healthy diet can promote overall skin health and resilience. Troubleshooting redness and irritation. Redness and irritation are the most common side effects of body waxing, typically mild and resolving within a few hours. However, there are several steps you can take to reduce these symptoms if they persist or are more severe. Immediately apply a cool compress to the waxed area to soothe the skin and reduce inflammation. Continue using a post-wax oil or lotion to keep the skin moisturized and calm. Avoid wearing taut clothing and refrain from swimming or bathing in hot water for at least 24 hours. If you have sensitive skin, consider using hard wax instead of soft wax in the future, as hard wax is less likely to adhere to the skin and cause irritation. For persistent redness or discomfort, consult a professional waxer or dermatologist. Troubleshooting ingrown hairs. Ingrown hairs occur when hair curls back or grows sideways into the skin, causing painful bumps and irritation. They are more common in individuals with curly or coarse hair, and improper waxing techniques can exacerbate them. To prevent ingrown hairs, regular exfoliation is key. Gently exfoliate the skin every 2 to 3 days to remove dead skin cells and prevent pores from clogging, allowing hair to grow out freely. Avoid shaving or waxing too frequently, as this can irritate follicles and increase the likelihood of ingrown hairs. If an ingrown hair develops, you can carefully try to remove it with a pair of sterilized tweezers, but avoid digging into the skin, which can cause infection. If you are unable to remove it safely or if it becomes inflamed, consult a dermatologist to prevent further complications. Troubleshooting allergic reactions. Although rare, allergic reactions to body waxing can occur, and it is crucial to recognize the symptoms and act quickly. Symptoms may include hives, swelling, widespread redness, intense itching, and in severe cases, difficulty breathing. If you experience any of these symptoms after waxing, stop waxing immediately if you are performing it yourself, and seek medical attention from a doctor without delay. An allergic reaction can escalate quickly and requires professional assessment. To minimize the risk of allergic reactions, always perform a patch test on a small, inconspicuous area of skin 24 to 48 hours before a full waxing session, especially when using a new wax product. This helps identify potential sensitivities before widespread application. Other common waxing problems. Beyond redness, irritation, ingrown hairs, and allergic reactions, other common problems can arise during or after waxing. Wax burns can occur if the wax is too hot or left on the skin for too long, causing pain and blistering. Always ensure the wax is at the correct temperature before application. Skin breakage or skin lifting can happen if the wax is pulled off too quickly, or if the skin is too dry and not properly hydrated. To prevent this, ensure the skin is well hydrated before waxing and pull the wax off slowly and carefully, keeping the skin taut. This is particularly important for sensitive or thin skin. Bruising can occur if the waxer applies too much pressure during the waxing process, or if the skin is not held taut enough. To avoid bruising, ensure the waxer uses the correct amount of pressure and proper technique, especially in areas with delicate capillaries. If any of these problems occur, contact your waxer or a dermatologist for advice. Choosing a qualified waxer. When opting for professional body waxing, selecting a qualified and experienced waxer is paramount for a safe, effective, and comfortable experience. A skilled professional possesses the knowledge and expertise to handle various skin types and body areas. Always inquire about the waxer's training, certifications, and years of experience in the field. A reputable waxer will be transparent about their qualifications and happy to discuss their expertise. Additionally, ask about their specific sanitation practices and ensure they adhere to strict hygiene protocols, such as using disposable tools and wearing gloves. Before booking an appointment, read online reviews of the waxer and the waxing salon to gauge other clients' experiences. Positive reviews often highlight professionalism, cleanliness, and client satisfaction. Furthermore, don't hesitate to ask friends, family, or your doctor for recommendations, as personal referrals can lead to trusted professionals. A qualified waxer can significantly minimize risks and ensure optimal results. Course conclusion. Safe waxing. Body waxing is a highly effective and popular method for hair removal, offering long-lasting smoothness and convenience. Throughout this course, we have explored its history, various types of wax, essential equipment, and detailed application techniques for different body areas. We have also delved into the critical aspects of health and safety, including skin conditions and medications that contraindicate waxing, as well as the importance of strict salon sanitation. Understanding these factors is fundamental to ensuring a safe procedure. By diligently following the pre-waxing preparation, applying the correct techniques, adhering to immediate and ongoing post-wax care, and knowing how to troubleshoot common problems, you can significantly minimize risks and achieve the best possible results. Always prioritize skin health and seek professional advice when in doubt.